Hello, my name is Cynthia. I have a 12 o'clock appointment.
Okay, come see you later.
Okay, thanks.
Hey Ed, you got a new patient?
Oh, why thank you. Hey Toby, how's your day?
Pretty crappy, man.
Got a lower back pain and sciatica.
No, female? 21.
You know, you're kind of busy. I'll take that for you. Jenny, come on over. Come on, have a seat. I'll check you out. So, Jenny, I see you have some low back pain.
I have some lower back pain in my lower back.
Oh, really?
Mm-hmm.
You know what? Let me see what I can find. Maybe I can make you feel better.
Unwelcome sexual advances are no laughing matter. Unfortunately, situations like Mrs. Baxter's occur all too often. Sexual harassment is defined as unwelcome sexual advances, requests for sexual favors, and other verbal or physical conduct.
As stated in the Journal of the APTA, evaluating sexual harassment within the context of the physical therapist-patient relationship is a particularly complex task. Many elements of physical therapy treatment require close physical contact. Asking a patient to partially disrobe, for example, may have the potential to stimulate sexual feelings and associated behaviors in patients. Such feelings and behaviors may or may not be perceived as harassment by therapists. Thus, to obtain a valid assessment of sexual harassment, one must take into account that a variety of sexual-related patient behaviors occur in the course of physical therapy, only some of which may constitute as sexual harassment. In 2014, 6,862 sexual harassment cases were filed in the United States, resulting in $35 million in monetary benefits distributed.
In one particular case, Harriet Desai versus Tennessee, the therapist was charged with sexual misconduct on 3 separate occasions. Within this case, one of the 3 female patients came in for physical therapy treatment for lower back pain. The therapist instructed her to remove all clothing from the waist up. He proceeded to touch her breast to assess her pectoral muscles. He then instructed the patient to come for follow-up visits to perform ultrasound on her breast. When the patient returned, he used his hand to rub ultrasound gel on both his breasts and then press his groin against the patient's arm. Over the next 6 months, 2 more patients filed complaints about the therapist's inappropriate behavior. According to the Department of Health, Mr. Desai engaged in sexual misconduct, failed to adhere standards of ethics, failed to maintain adequate patient records, and failed to supervise unlicensed personnel. Mr. Desai was forced to surrender his license and unable to practice physical therapy in the state of Tennessee, and had to pay civil penalty in the amount of $1,500.
As you can see, Mr. Desai's actions were highly unethical. He failed to provide the standard of care that is expected by all physical therapists. He lacked respect, integrity, and responsibility, which are key principles of ethics that we should all abide by. Furthermore, he violated the core values of professionalism by abusing the trust of his patients. With all of this in mind, let's now go back to Ms. Baxter's scenario to see how her situation could have been conducted in a more professional manner without violating ethical codes and the patient's rights.
Hi, Miss Baxter. I'm Eddie. I'll be your physical therapist today.
Hi, Eddie.
How are you?
Oh, not so good. Some pain on my lower back.
Oh, I'm so sorry to hear that. So we're gonna run some tests and see where your pain is. Are you okay laying down on your stomach?
Yeah, that's no problem.
Okay, let's do that now. Okay, so I'm gonna feel your lower back and see where your pain is. So is that okay with you?
Sure.
Okay. Let's see.
Oh, right
Oh,
there.
there.
Now, here are some other scenarios that one may be exposed to in a clinical setting.
So, Alex, we're gonna stretch your piriformis today, okay?
Okay, what's that?
Right, don't worry about it.
okay. Oh, okay.
Just relax. Just relax.
Ooh,
Just relax.
so I'm just a little uncomfortable.
Does it feel okay?
It's just a little uncomfortable, the position. Is there any way we can do this differently?
No,
No.
this is really the best.
Hi, Alex.
Hi,
How are you?
I'm good, how are you?
Good. We're gonna do a piriformis stretch.
Okay, what's that?
So we're gonna work on some muscles near your glute.
Okay.
Do you have a change of clothes by any chance?
I don't, because I just came from work,
Okay.
so.
Okay. So let me get a towel and
Okay.
we'll figure something out.
Sure.
Okay. So I'm gonna place this over.
Okay.
Just hold it on that
Okay.
side there. How does that feel?
Good.
Do you feel a stretch?
A little bit.
Okay. So I'm just gonna push a little harder on you.
Okay.
How's that feel?
Good.
Hey, Jordan, what's going on,
Hey.
man? How you doing?
Good.
Yeah, you've been working out.
Yeah, a little bit.
Yeah. Good. It shows. Let's do some squats, okay?
Cool.
All right, cool. You got it. Step forward a little bit. We'll just we got some room. Okay, cool. All right, sit back into your hips. I'm just gonna spot you a little bit, okay?
Sure.
Yeah, it's fine. It's
Okay.
fine. Keep sitting back. Keep sitting back. Good. A little lower. No, you got it.
Okay.
No, it's all right. Okay, keep going. Good. One. We'll go for a couple more.
Okay.
Keep going. You got it.
Oh,
You got it. No,
oh,
no. And up. And up.
okay.
Yep, that's right. Okay, one more. One more. You got it.
Wow.
Sit back.
You-
Sit
you're
back.
kinda close, man.
No, it's okay.
Oh,
Just focus on the squat. Keep going.
Okay.
All right. Good job. Good. All right. Good job.
Hey, Jordan.
Hey.
How's it going? My name's Eddie.
Alright.
We're gonna do some exercises today.
Sure.
All right. We're gonna do some squats. I'm just gonna grab the bench.
Okay.
A little support. Good. So stand over the bench. Good. I want your feet shoulder width apart. Good. And now when you squat, I want to make sure your knees stay behind your toes.
Okay.
Good. So come down. Good. Excellent. Come up. Good. Two more. Good. How does that feel?
Feels good.
Okay. Any pain?
No pain.
Good. Good. Let's do one more. In addition to client-patient relationships, sexual harassment can also occur between employees. As an example, let's now take a look at how it can negatively affect the work environment and damage personal relationships.
Hey, Jordan, how we doing today?
Hey.
You free tonight?
No.
No?
No.
You really busy?
Yeah.
It's Friday night, man.
No, really busy. The groceries, stuff like that.
I'll let you pass on this one. Alright? Been working out a lot, huh?
Yeah.
Alright. Next time. Alright, next. Hey, Jordan.
Hi.
Hey, how's the day today?
Good.
You catching up with the news?
What's happening?
You know, the United States passed a bill. All 50 states, gay marriage is approved.
I did not get that, man. I'll let you know.
I should give you more, I should show you more about it. What? Jordan, not off yet?
No, man.
Alright, I'm gonna head out further, alright? Take care, man.
Alright.
Ooh, you're kinda tense tonight.
I'm good.
You sure you wanna come over and
What?
give you some good massage?
No, I'm good.
I'm a physical therapist, you know. Sure?
Hey, Jen,
Hi, Alex.
can I help you with that?
No, I'm good, I got it.
No, I think you're gonna really need my help with that.
No, I don't need help.
No, you do.
These are all examples of how one should and should not act in the physical therapy environment. Statistics show that 86% of physical therapists will experience patient sexual misconduct during their careers. Because of the physical therapist and physical therapist assistant direct contact with patients, they must always practice good judgment and professionalism, no matter how tempting or challenging the situation. Thank you.
Thank you.
Thank you.
Thank you.
Thank you, and do your squats. Hey, how's your day going? Good. We're gonna do a piriformis stretch.
Okay, what's that?
Good. That's
I have a 12 o'clock appointment.
Yeah, the patient will be.
Cut.
Alright.
So I'm just gonna spot you here, okay?
Oh,
So-
oh,
yeah,
okay.
no, just.
Oh, keep sure? Wait. So, did you consider this case unethical?
Well, Chuck, you know, the facts kind of stand for themselves, but I think there's a lot to this case we don't know. Like, why did the patient return for the second visit, after she, claimed to be harassed the first time? So it's kind of odd to see there's a lot of facts missing in the case. But either way, it is unethical for, a therapist or anyone else to conduct themselves in that manner. I mean, the details get pretty gritty. You know what I mean?
Was Dr. Desi's penalty too light?
We believe so. The settlement was for $1,500, so this was basically a slap on the wrist. I mean, we found other settlements ranging between $250,000 to $750,000 for sexual misconduct.
In cases like this, what would have been an appropriate penalty?
Well, in cases like this, as Eddie said before, it was very light. So we believe that appropriate other actions such as jail time or possibly being on a sex offender list or something along those lines can kind of would be a little bit more appropriate, because this was a statewide case. So he can go other places and still practice physical therapy or other places. So to be on a list can be a little bit more appropriate.
How could a situation like this have been prevented?
Honestly, I think this kind of situation can be prevented if the therapist followed a protocol, the standard of care, and put his desire or his emotion out of the work practice. He could do whatever he wanted out of work, but in a professional setting like this, he definitely has to follow the standard of care and the scope of practice like every other therapist does. Be professional, respect the patient, and definitely don't violate any laws.
Hey Chuck,
How you doing?
I like the hair.
Thanks. So how was your overall reaction to this particular case?
For this particular case, I was actually surprised someone would even try that in our practice. That was blatantly rude, disrespectful for the patient, and it makes physical therapists or physical therapy assistants, the profession, look horrible. It's not good for our image as something that cannot be tolerated.